Hello everybody, my name is Dr. Dave Eshom and I welcome you to my cosmetic dentistry video on YouTube. Today in cosmetic dentistry I'm going to be talking about Lumineers, which are thin porcelain veneers, and tell you a little bit about them, who they're for and so forth, and dispel some of the rumors around Lumineers so that you can make the best choice of the type of veneer you would like for your new smile. So Lumineers actually is the name of a certain type of porcelain veneers made by a company called Denmat. They're very thin, contact lens thin veneers that are set right over the teeth with no tooth preparation. That all sounds very wonderful and works in some instances and doesn't work in others. But what I really want to tell you about Lumineers is that they're not the only thin contact lens thick veneer. Almost any porcelain veneer made by a reputable lab can be thin and contact lens thick. So you can get the product named Lumineers, or you can get some very thin porcelain veneers. And most of the time when you're talking about veneers like that, you're talking about what we call Prepless. And I'll go into that more later. But in today's video, we're going to tell you what Lumineers are, where are they best used, what could be their problems, and how do you know if you're a candidate for something like Lumineers or Prepless veneers, and then who you should see to have your smile done possibly with Prepless or Lumineer type veneers. So here's some pictures of Lumineers, or very thin porcelain veneers. Again, they're the same thing. They're wafer thin. You don't require little or no preparation of your teeth, meaning you don't take any of your tooth structure away. But really, it's just a product name, Lumineers. Any dental lab can make very thin porcelain veneers and be Prepless also. So Lumineers are no prep veneers, or porcelain veneers, are ideal for stained teeth. They're also good for chipped teeth. They're good for teeth with spaces. And they're especially good for teeth that are tipped in. As you notice this picture down here, Bonnie's teeth are tipped in her smile, and her teeth are kind of small and irregular. So no prep or Lumineers, or no prep porcelain veneers or Lumineers are perfect for this type of instance. The problem with Prepless veneers or Lumineers, when they're not done in the right circumstances, is that they can look fat and bulky and fake, really. And so if you see the picture here to the right, these 4 veneers were done, and they're very fat and bulky and don't look like the natural teeth. They're too big. The other problem with Lumineers is if you have some gum missing here, or you've had some recession, they won't cover this black triangle that can be right here in between the teeth. So when an inexperienced dentist tries to place no prep veneers or Lumineers in the wrong circumstances, they can turn out like this. But a cosmetic dentist that has experience and knows what they're doing can make the veneers look just like this. And then these veneers are mine here. This was the patient after she had some bulky, inappropriately placed Lumineers. And then this is the way I changed them to make them look more natural. So it's important that the cosmetic dentist has experience, knows where to put them, and then also that they make you temporary so you can see what your teeth are going to look like in the temporaries before you get the permanents, and consequently make some adjustments if you're not happy with the shape or the contours. So the big key though is how much experience you have and doing the right diagnosis. Again, you want to do them on teeth that don't need to be, that aren't bulked out, that aren't sticking out of the patient's mouth. And then you want to make sure that your lab has the experience and the artistic ability to make the teeth look very natural like they have done here. And then this is again my before and after case here. And then you also want to look at the dentist's credentials. Do they have any credentials in cosmetic dentistry? You want to make sure that you look at their reviews. Have they made the patients happy? If a patient isn't unhappy, have they been able to make them happy so that their reviews are positive? And then the last thing is they should offer a free consultation so you can come in, get to meet them, get to know their office, get to know the doctor, and see how much care and concern they're going to put into you and how much they'll individualize your smile. So here, this is my office. We see one patient at a time. We are very high tech and use all the greatest materials and the greatest equipment to make sure things are comfortable for you. So we're that type of dentist that cares about you and designs your smile. I'm credentialed in cosmetic dentistry, so I know about all the different cosmetic situations and where to apply them. Again, you can see my before and after here and my before and after for Bonnie, and how my teeth look natural and are symmetrical, and then complement the patient's face and smile and lips. And so if you'd like to come in for a free consultation, we'll invite you. Please come in, give us a call. We'd love to help you get a better smile and hopefully do it with some Prepless type veneers. Thanks for listening today.